Okay, well, welcome everyone today. I am so excited for our guest today. Her name is Dr. Dawn Kingston, and her team are passionate about helping women and their families have the best start to life by improving maternal mental health. She is Canada's only endowed research chair in perinatal mental health. Her research focuses on improving perinatal mental health care by developing and evaluating approaches for screening and treating women who struggle with depression and anxiety during depression. So welcome, Dr. Dawn Kingston. I'm so excited to have you here.
Thank you, Erica. I am too. I'm excited to be on your show.
So this is definitely a topic that has come up on and off over the years, and one that I feel is definitely not talked about. And I discovered that because I was looking over, your blog posts and website and your information, and I was like, this is why there's a lot there to talk about. So we have a lot of great things, got a lot of great questions for you today. So let's start off. I want to ask you, what led you into wanting to specialize in this area, this maternal, healthcare of mental health?
Yeah, it started really, I was a neonatal nurse, so I am a nurse, but I have a big interest, as you know, in mental health. Started as a neonatal nurse, and, I started to really be interested in how can we prevent preterm birth? How could we prevent low birth weight babies, preterm birth, some of these outcomes, birth outcomes that make it so hard for families going forward in their new lives. And so I started doing a master's, and I realized that the biggest connection was stress and preterm birth. There was a lot of research out there about how prenatal stress contributed to preterm birth. So, but the more I became interested, the more I realized it wasn't just about stress. It was about stress, depression, and anxiety. And it wasn't just about preterm birth, low birth weight. It was about mental health and child development and health across a child's life well into adolescence and adulthood. And I started to realize that really those prenatal years were framing the well-being of the child going forward into adulthood. But what became interesting to me as a person who's always interested in impact and change is there was nothing, we weren't doing anything about it. So we had 25 years of research showing that stress, depression, and anxiety had an impact on children, and yet there was nowhere in the system where we were making a difference. We weren't screening women in pregnancy. We weren't, and if we can't screen women and help them to detect their symptoms, then we can't help them to get help and care and treatment. So it seemed to me that there was then an over focus on postpartum depression, when in fact, most women with postpartum depression had symptoms first in pregnancy. So I became very interested in how do we change the system? So, so that we can have early detection and early mental health care that sets women up well for the years to come.
Oh, I love that. That's amazing. And as you're speaking, I'm like, there's a lot of where it's just this whole interconnected. It's just the kind of the cycle that's been going on and on and on, and it just keeps continuing unless someone's interjecting and doing something about it, right?
It's a great way to describe
So
it. Yeah.
yeah, so many things to talk about, but I do want to ask you this one question that came up was, why do women struggle with feelings around anxiety and depression during pregnancy? So let's talk about that, because you're saying that's really where it starts for women, is during pregnancy. So is it hormones or is it something else?
It's actually very, very little to do with hormones. That's one of the big myths, I think, is, and a reason why a lot of women don't get help is because they think, oh, it's just my hormones. I've got the blues in pregnancy. I've got some worry about the delivery, and this is all normal. So I think a lot of women don't realize that it's not normal. Some ambivalence is okay. We all experience that. But I think women don't women don't always recognize the symptoms that they have. It's not generally hormonal. It's very, very little to do with hormones. Even postpartum depression has very little to do with hormones. There are really four big things that contribute to prenatal depression, anxiety, and postpartum. They're the same things. But the biggest one is really if a woman has struggled before at any time in her life with anxiety, depression, trouble coping with stress, there's no shame in that. And it's important that women know that that's something that could lead to them having more greater vulnerability to stress, depression, anxiety, and pregnancy and postpartum. Knowing that means that women can, like having high blood sugar and diabetes, just manage it. We can talk more about that. But that's one of the big things, having depression or anxiety or some trouble coping with stress or having some life stress going into the pregnancy. So that's the first one. The second thing is really if somebody's not having social support or having partner conflict. So people that think, women that think that our marriage is going to get better or my partner relationship is going to get better if I get pregnant, it's not true. It's dangerous because women need that as a preventive factor. The other piece is if women have had a lot of stress. We talked about that a little bit, but high stress, having depression or anxiety before, not having enough social support or a good partner relationship are really key. And when I say not having social support, that's not about the number of friends that women have. It's about the quality of relationships and how much investment we're making in connecting. We're busy sometimes, we're talking sometimes about women who have other children, and it's just hard to get time with friends, isn't it? But that can be a real challenge.
So let's see, was that all four?
Oh, the fourth one
Okay.
is,
Yeah. Then I want.
yeah,
Yeah.
sorry, thank you. Yeah. Personality. So let me talk about that. There are two kinds of personality types that it doesn't mean a woman is going to get depression or anxiety. It just means she's more vulnerable. And the first one, and I think the one that is not talked about at all, is perfectionism and guilt. So, there are about 30% of women that are in that category where they're high driving. Now, not just high goals or high expectations, it's unrealistic goals and expectations and feeling like a failure when goals are not met. I think what's particularly striking, and I don't see it talked about a lot in pregnancy, and yet it's the thing that continues years beyond after the delivery, is struggling with guilt and about various things. I'm not the mother I should be. I had anxiety during pregnancy, so I've set my child up for trouble. I haven't given my child the best start in life. All kinds of things that we beat ourselves up about. But that's a personality type that leans in that direction. The second personality type it's called neuroticism, which is a terrible name, but really what it means is just someone that is a bit more reactive emotionally to situations. If you find yourself having stress in your life and it takes more for you to calm that stress down, or you become more worried about things that other people might be less worried about. So it's just an overreactivity. It's a bit of an emotional reactivity. That's the way. So they're not negative things. They are just personality tendencies that mean that we're a little bit more vulnerable to stress and anxiety and depression.
So Dawn, I
All
love
these
that.
things.
Yes. I think that, and I'm really big on prevention, right? That's why I love talking about
Yeah.
all sorts of topics. And I love that you're really getting into some recognition for how a woman could recognize, no matter where she's at, even if she's had a couple of babies or down the road, she's like, well, I don't know, maybe I do want to be a mom someday. Maybe I don't know, but these are some things that could
Yeah.
help her to be aware and start. So can we start with the last one? Because I feel like that's, you talk about the personality traits, and I'm a firm believer that, we can improve upon anything about ourselves that we would like.
Yeah.
So I feel like for anybody listening,
Yeah.
that if any of those kind of sounded like you, and a big one when you were talking that came to me was like the mommy guilt thing. I feel like
Yeah.
that is, and I feel like every mom, suffers some degree to that, because like everything kind of changes when you have kids. The way
Yeah.
just more emotional about everything, right? Because it's like your kid matters more than
Yeah.
you. So many, so, but not specifically about that, but in general with like the guilt, do you have specific suggestions that you teach, women, whether they're a mom or not, that they can do to start to, I guess awareness is the word that comes to me, because I always feel like awareness has to be the first piece in order to improve upon anything about ourselves.
Yeah, I love what you're saying too, Erica. And I too love the prevention piece, which, was kind of why I got into this, thinking about stress and preterm babies and how can we turn this around. I also am a firm believer that every one of these things is an area that women can change. And I guess that would be one of my basic philosophies and that of my team, that, we want to help women find the path forward, find the path that allows them to have better quality of life. So thinking about that guilt piece then again, we've written a little bit about this. It's an area that we're starting to, I think, teach more around and talk more about on our blog. But really and I love it. If I could describe this formula to you. I
Absolutely. Go for it.
It's one that we're teaching more now about, but it's an absolute wonderful tool for life. It's not new. It's just a really simple tool. So it goes like this: E plus R equals O. So E is event. It's the thing that happens in our life. O is the outcome. It's what happens as a result of that. And that R in the middle is our response. If you can almost picture it like you've got something that happens and it's going to lead to an outcome, and in the middle is this cloud, which is our response. So, the response piece, it's in the brain. It really is. It is about controlling our thoughts that control our feelings. Now, that sounds simplistic. It's not, it's hard, but there's neuroscience behind it. So here's what happens. If something happens, let's say at work, we've used this example before. At work, somebody says to her pregnant friend, "Boy, you look like you've gained a lot of weight." So a woman might normally go right to a spot where she might feel inferior. That might be the outcome. Feel incompetent. I'm not a good mother. I'm not doing what I should be doing. I'm messing my child's brain up. I'm not setting my child up best for life, etc. But there's a moment in there when she can change that flood of thinking. And it's neurological. So if you think about it, it's almost like our thoughts in our brain are almost like a river, a river that's flowing along. It's happy to take its course. Our thoughts are happy to go down the same direction we've been taking them down for years, connecting, weight gain with incompetence as a mother. It sounds crazy when we think about it, but our brain does that automatically, especially if we've let it do it for years. My weight means I'm less of a person. My weight means that I can't control myself, whatever the thinking is. But neuroscience tells us that you can redirect that. And it's almost like having a tributary come off that river and start a new path. And it's shallow at first, and the water doesn't go down it very easily, but the more we think that thought, the deeper and more entrenched it becomes, that pattern in our brain. So that's the key. That's the neuroscience that underlies changing thoughts. most people find that it doesn't actually take a huge amount of time to take an old thought pattern and take it to a new thought pattern. It can happen in a couple of days, but it happens in that moment. It's that choice to realize that I'm living in threat or fear or failure. And instead of thinking in that direction, turning that thought to something about possibility, to a
Absolutely.
optimistic possible thought. So, and we call that upper brain and lower brain thinking in our work. Upper brain thinking is really is this, if we are thinking from our upper brain, and again, neuroscience based, you know you're in that space because you're thinking about options. You're not feeling that there's only one or two options. You have creativity. You can think about lots of possibilities. You feel optimistic and hopeful. The idea of change is great, not threatening. If you're sitting in that lower brain, that part, it's the space of threat. It's the place where you want to either run away or defend yourself. It's that spot where you feel insecure and fearful and threatened. See the difference?
Absolutely. And the skill set that you taught us there, I feel like that is one that anybody can use at any
That's,
time for really anything. And you
yeah,
have the power. And I just feel like it gets so easy, especially as everybody gets a little bit older, those habits become so more seated that we kind of think you can't change them, but you can change them. So I have
right.
a question for you because, we're talking about changing, and I know, like, I'm a firm believer. I've done a lot of, training and stuff with the neurological understanding mind body connection and all that. And it's fascinating. And I see the impact it makes just through movement, which,
Yeah.
what I teach. So this is kind of the same thing, but instead of it affecting our movement and how we're feeling in our body, it's affecting our brain particularly. And I think it's so fascinating that we can change our brain, because it wasn't that long ago when they were like, oh, nope, you can't change it, but you really can. And so what about someone who says, I've tried that so many times, and they feel like doing a simple skill like that of trying to be so aware and kind of flipping that thought process and catching themselves, and they just tried it on and off, like, what's the next step for them? And maybe that goes into like one of your other pieces of, I feel like, kind of that support system, the social aspect, maybe be a next really good piece to dive into a little bit more. Because I feel like that's a huge piece, right? We have the
Yeah.
ability to affect what our thoughts
Mhm.
are, but those around us are also influencing what we're thinking.
True. Good point. I guess two things. When somebody says, I've been trying that over and over again, my answer would be, in part, it does take over and over. That's normal. It doesn't change one time, but every time that we change our thoughts, there's a small victory, and it gets easier next time. And it gets easier because that the brain is forming new paths. So it does take effort. And I can tell you, even recently, I had a really probably the most difficult experience that I faced in my career so far. And I think that it took about 10 days of really hard watching my thoughts and flipping them constantly. Think every time I kind of get into that spot where I'd either be teary or I'd feel quite hopeless, or not seeing possibility in the situation, I would turn it and I would say, what is the opportunity that this is presenting? What is possible because of this very tough situation? And that was the thought pattern that kept flipping me, but it was tough. I think social support is perfect. I love the way that you brought that up as well. And it's interesting because it's something that I don't, I think with all of the connection that we do, we don't fully understand the power of the other. We dip into conversations and we dip out, but how many people, how many women really have supportive relationships where they feel that they can talk about this? I think that when we do talk about where we're at, if we had a trusted colleague or a trusted friend that could say to us, boy, it sounds like you're really living in fear, you're living in threat, that would be a great response. We're living in a place, your brain is where you don't want it to be. This is what's compelling too. When you dip your brain into that lower brain, allow your thoughts to go down, your body responds with a flood of stress chemicals. And those stress chemicals can last in your body as long as 3 days. So that's a pretty long time. The mind is powerful, So it begins in the mind. It absolutely does. Supported by friends, great next step. I always think too, the other piece, there was a book a while ago that came out, was Your Brain on Nature, the power of nature to help us to stay upper brain. So I think that the best combination of all is going for a walk with a friend where you're combining exercise, social support, outside.
Yes, that is one of my favorite things to do, actually, by the way. Yes.
That's like the best cocktail.
I love it. And I'm missing it right now because it's been so cold and snowy.
Yes.
But for me, at least, like one little piece is like where we live, we have a lot of nature. So even if I'm not outside, it's seen it. And so I think sometimes for people that just even be able to see a little, like go by a window and get a little sunlight, right? When it's so cold out, even if you can't go outside, and all of that is so powerful. So you mentioned stress. I want you to talk about stress, because stress is something that really affects everybody. I feel like way more than it needs to. Well, not everybody, but most people. Once you learn how to, control it better, or be, again, we have the power to change anything, we don't, but the stress kind of cycle starts. And maybe that's a big piece, because like you said, if you have a stressful response, if it stays for 3 days, and somewhere in that 3 days we're having another stressful response, you just can't like get out of that vicious cycle. So let's talk about stress. And I mean, okay, I probably have a lot of questions on that, but I'm going to let you start and just dive in and tell us like what you see stress, how it affects. And again, I feel like, again, with the stress, can we take that same approach with our thoughts with stress? Do we have to, do people even realize if they're being stressed because we have so much stress in our life?
Yeah, it's boy, there are a lot of great questions there. And you're right. Really, let's start off by distinguishing good stress from bad stress, because there is good stress, right? There's the stress that the athlete feels. This is probably your area, Erica, that healthy stress that gets us going and helps us perform better. There's a healthy stress that helps us to do well on exams if it's not overboard. The problem is when stress is too high or for too long, that we can no longer manage it. That's what toxic stress is. It's unmanageable stress. We might have, our parent might become ill and we feel like we're coping well. We've got good social support. We've got friends we're talking about. We're in a good relationship with our partner who's supporting us, and we're managing through this difficult time. That's okay. That's normal stress managed well. But the point when we say, I can't do this anymore, I am done, that is when we've crossed the barrier to toxic stress. And toxic stress is a bit scary because it often becomes chronic. And then that's exactly what happens when what you described, Erica, that your stress response peaks, but it never drops to where it should drop for normal levels. It's just staying at a chronically high level. Our stress response was always meant to be a healthy, good thing. If you want to think about it from an evolutionary perspective, it was the thing that kept us protected from danger. And it's still meant to protect us from danger. If you get mugged in a back alley, you want your stress response that simply does this. It puts you into, two thinking. I'm either going to stay or I'm going to go. Black and white thinking. Your digestive system shuts down, your heart rate increases, your breathing increases, your blood pressure increases. Everything is so that you can either fight or get out of there, get out of Dodge. But that most of the time now in our current world, it's social stress that's kicking us into that space. It's social threats, social stress. It's looking at Facebook and seeing beautiful, perfect families. It puts us into a place of threat. Yeah. Is that helpful as a starting point, Erica? Oh, you're on mute. Oh.
Sorry, guys are working. He's trying to hang on really quick. Sorry, Dawn.
No worries.
Okay,
So
she'll
stress
be
is
edit that out.
I think
Okay.
stress is particularly bad in pregnancy because, yes, in and of itself, it can have an impact on the child. It can have an impact on mom and mom's quality of life, etc. But it's also, as we talked about, one of the key reasons it can evolve into stress and into depression and anxiety.
So I have
So
a
it's
question with the stress. So because I feel like so many deal with anxiety and depression, and I do feel like for so many they come hand in hand, right? Most people don't just have
Yep,
one or
they
the other;
do.
they have a combination of both. So if we actually
Yeah.
take a step back and look deeper, are you seeing that it's stress really is a big root of those two? I mean, I've dealt a little bit with that, and but I can tell you that I can definitely see where stress, or the mechanics of the body, the chemistry of the brain, and all of that, because we're maybe lacking some nourishment in a sense too. It's kind of a
Yeah.
lot rolled in one there, but I guess the first one is, do you see when you get women to get their stress under control, regardless of pregnancy or not, like anytime, right? Pre, during, post,
Yeah.
that really makes a huge impact.
It does. And again, when I talk about those 4 risk factors, stress being one of them, these are things that we see all over the world, all ages, all cultures, all countries. They're the big 4. So it's interesting too that it doesn't matter what culture you live in, stress is like it's that human experience that when it turns rogue, it has this, really negative effect. And yes, it is a root of depression and anxiety consistently in pregnancy, outside of pregnancy. So
So,
managing stress becomes a big issue.
so what do you see as the most successful at helping women manage stress? Because I actually feel like I get more women that will say, reach out, that they're really stressed, and you can feel their frustration in their messages. And I feel like they are probably dealing with some of that anxiety and depression. And then it's just like when it starts to snowball, it's like they got to put that stopper in the gear and be like, look, starting today, I'm going to take action, even if it's the tiniest little action. So from a stress perspective, because I know it's easy to say like, oh, just start meditating. Well, from personal experience, like that's hard. That's even been hard for me. Like, just to say, I'm going to just start meditating. And I know a lot of people have the same issue. It's not as easy to say, oh, just go meditate, right? Like you actually have to do it. And I feel like it has to feel doable, and it has to feel like I can do a little bit of something, and it doesn't have to be perfect, right? The perfectionism, we're going to get to that. But
Yeah.
what are your recommendations around stress and starting? Like, what do we do to start?
I think it's different for everyone. I think we have to help women to identify what it is for them. And I think it's not always one thing, it's a combination of things. You
Yes.
know, if we think about it, what would you say, Erica? Most stress is related to relationships, right? It's relationships at work, relationships at home, relationships with in-laws. Most of the time it comes down to something on a relational level.
Okay.
I don't get along with my boss, it looks like a work situation, but it's relationships in work. So I think one of the things, or just right off the bat, some considerations. What is the first small win? Small wins are critical. What is the first small win that we can do? Is it running? Is it walking outside? Is it talking with a friend? What do you need to get in your life as the first thing that starts to make it possible to work on stress if it's a long-term challenge? So, I mean, that might be, well, let me walk back. I'm always amazed when I look at the Australian experience and the colleagues that I have in Australia and their lives and the priority that they place on, for example, getting up and having a coffee on the beach at 6:30 every morning with a trusted friend.
Well,
Doesn't
that
that
sounds
sound
wonderful.
great? I know, but that's not possible for all of us. But there are things that we can start to put in our lives that help us to take the next step. So I think for women, asking a couple of questions like, what would I need tomorrow in my life to feel some relief? The
Mm.
flip side of that is, if tomorrow came or next week came and I was still feeling this way, because I was still doing this, what would I not want to be doing next week? That if I could look ahead now, I would say, if this is the way it is next week, I'm just going to go crazy. So it's kind of two ways of thinking about what is one small step that can happen. But I think, you've talked about exercise. Does it have, if meditation, social support, getting out in nature, journaling is a big one for some women. Recording your thoughts on paper, starting to process ideas on paper. Yoga is another one that we've seen effect for. Mindfulness. So sometimes it's getting our eating under control. That is the first thing that gives us a semblance of control. I think all of these things, whatever first step we take, has to be small enough that you commented that we can do it. But I
Mhm.
think it also has to be the one that we feel like brings some measure of control back in our lives, because often that stress is because we feel like we just don't have control. We have
So
lost control.
yeah, I hear you saying control a lot, which is interesting for someone who's working to not have so much control. You know what I mean? When you have so many things that really are uncontrollable in your life. So is it a safe thing to say, like, maybe control for some, but maybe it's more happiness, like something that makes you feel happy, but gives you a little bit of that? I'm just curious um, because when you talk about the perfectionism and the control, I don't know, and that's just something that came up
Yeah.
for me. Is there a way to help someone? Okay, it may make them feel like they have more control over what's going on, but is that feeding kind of the perfectionism, or is it better to let them kind of let some stuff slide and really have them reach outside the box and be like, what can you do to improve your happiness? But maybe improving happiness doesn't help. Do you know what I'm saying?
Yeah, I do. I do. I think it's an issue of how much control we are. I think it becomes whether this is a reasonable control. We need some control in our lives because that helps us to because lack of control and ambiguity isn't always easy to manage. But the other part is almost a compulsive control, right? If we
Mm.
that perfectionism, that's an unhealthy perfectionism, it's a compulsion. It's like, I must have this to be happy. I must do it this way to be happy, versus, you know, uh, there is just no control in this relationship situation, bringing back some control. Part of that is, how do we do that in relationships? Part of that is boundaries, right? Is creating boundaries. There's an amazing book by Dr. Henry Cloud, called Boundaries. Do you know that, Erica? Have you ever seen
I
it?
haven't, but I will
Oh,
check it out, and I will, anything you
yeah.
recommend, you mentioned, I will put in our show notes for any of our listeners to check out, but I will
It's
definitely check
wonderful.
it out.
Yeah,
Yeah.
it's about boundaries for parenting, boundaries for
Mm.
leaders, boundaries in general, just about how to set healthy limits, healthy boundaries, so that we don't get ourselves into that um, stress route where we feel like we have no control anymore in our lives. Our lives are controlling us. We're not controlling our lives.
Thank you for clarifying. I'm glad I asked my very
Yes.
heavy loaded question, but I appreciate you clarifying, because for me, that helps me say, okay, it's really kind of comes back when it's control. It's more about having boundaries, that to me, versus the control on the perfectionism side. Right. So I just wanted, you did a very good job at clarifying that so that we can all differentiate. So,
I
um,
think I think too, just to add on to your point there, I think when it's a control that is I must have this kind of compulsion. It's rigid too, right? It's a rigid control, versus a flexible, everybody needs to know that they're managing their lives and have, some degree of control in their lives. We're just built that way.
Absolutely. Yeah, no, thank you. That was wonderful. So let's dive in and talk about this perfectionism a little bit
Yeah.
more. I know you specifically talk about, perfectionism, during pregnancy, and I'm sure I don't know if it'd be worse during pregnancy or postpartum. For me, I would say personal experience worse during the postpartum phase, because now you have this baby that's outside of you, and it can be an added piece of not having control, and you don't know what's going on, and right, that cycle. So I would
Yeah.
love to have you speak to that, because I feel like the pressure has got, my oldest is 12. So I look at the change since becoming a mother, and with the social influence now, like you have all this people making motherhood look like perfect, or it has to be just so, and all the different, I don't want to talk about any specific issues today, but you have all of those, and it kind of puts that pressure. So how can a woman, help to, what are some skills and stuff that she can do to help not get stuck in that trap, or if she feels like she's there, to help her pull out of that? Because we are our own individual person. And as a mother, man, every woman has incredible intuition. And I think that's a big piece for me personally that has helped me.
Can I just, before I respond,
Yeah,
throw that back to you,
sure.
Erica and Tommy? How does intuition play a role? How does it help you?
It brings me into my body, and that's a big thing. And intuition is definitely, increased for me over the years. But
Mm.
for me, I just always feel like there's this sense of knowing. And, if one of my kids is sick or something's going on, or maybe they don't look like, I don't know, maybe they're not necessarily, like my husband might be like, oh, everything's okay. And I'm like, no, there's something going on, or it's not this, or it's that, or whatever it is. It's that sense
Mm.
inside the body of just
Mm.
feeling like there's more to this, or I'm going to keep diving in deeper, things like that with anything and everything, especially
Yeah.
around the kids, right? Because
Yeah.
they feel like such a part of you, especially when they're little, right?
Yeah. Yeah. I love what you said, Erica. I think you've really hit on the key here, which is,
Yeah,
trusting
trust.
myself versus deferring to the expectations of others.
Mm-hmm.
And
Yes.
that's and it sounds to me like you've also hit on another key point, that this is very in the moment. It's situation by situation, not, today and for the next 6 months I'm going to manage my perfectionism. It's situation by situation. But I think that's the heart of it. Am I going to trust myself and what I think is best for my child, given that he is my child and I birthed him and we
Yes.
know each other intimately? Or am I going to, lean on the expectations of others? And that's where the social media piece and whatnot comes in. It's the perfectionism that's unhealthy, is about not feeling like you can meet the expectations of others, feeling pressure to do it, and feeling like you're not doing it successfully. And those expectations can come from two places, right? Internal or external. They can be
Mm-hmm.
my expectations of my own behavior or social expectations. But it's interesting because the few studies that have been done in pregnancy show that it's not really about women having expectations that are too high for themselves. It is the social
Mm-hmm.
expectations that are hitting us at this time. Do I'll give you an example too. I have two boys. One is 24, one is 25. I remember when my oldest son was born, I was a neonatal nurse, had been a neonatal nurse with babies for a long time. And I was walking him in this beautiful old English pram somebody had lent me. It was very windy out, small town. I'm walking him down the main street to get the mail, which was our thing we did every day. Even in the winter, we got out in this big pram with large wheels. Anyway, and somebody said to me, "Oh, it's so windy, he's going to catch wind." And I thought to myself, how could I not know about catching wind? How could I not know that I'm ruining him for life? He's going to catch wind. What is catching wind? How could I not know this? But it put me into a spin again because I doubted myself, and I'm thinking, how could I be a neonatal nurse for all these years and not know what this is? It's amazing what other people's views and expectations can place on us. But I love the way you frame it as intuition or trust in ourselves. Trust that we know what is best for our own child.
Absolutely. And I'm sure everyone listening can relate to some sort of story like yours. Yeah. I remember when I had my oldest, and we lived in Southern California, and I'd put her in my little wrap and walk around, and, you dress your babies like you dress yourself. So I didn't have, any socks or anything on her because it was warm out. And all these old women would always come up to me and be like, she is so cold, you have to put socks on that baby. And I'm like, just leave me the heck alone and let me walk and do my thing. So
Yeah.
it's just like, you just say, thank you for your input, and you move on with your day, like take the high road and go from there. But yeah, it's hard though, right? There is a lot of that external, and the more external kind of feedback you may be getting, not even asked for. As I feel like pregnancy and having a new baby are two big times in life that you get all unwanted advice, and you're like, dude, shush, just shush, I don't need it. So
is there a way we can help each other too, Erica, that we can build a different culture? This is always what we're thinking about, how do we do this? But if we are all beautiful, I can tell you, my sister just recently had a baby, and we went to swimming classes and library time. She came from the UK for a couple weeks, and everybody there looked perfect. But what if we didn't show up like that? What if we could show each other empathy and just simply express, yeah, did you have a tough morning? I had a tough morning getting out of the house this morning. I'm not at my best. And I think when we start being authentic about what life is really like, I think that that definitely opens up opportunities for people to relax, be authentic, and have empathy and say, this is a tough phase in life. So I wonder if it begins with empathy and authenticity and courage to be able to say, man, I'm having a rough week.
Yeah, I think that's a great start for sure. Yes. Sorry, I was like totally out of thought. And that's
I can jump in. It's interesting because, I'm in my mid 50s. My friends and I now say, man, remember those families that we sort of were around when our children were little? Remember we looked at them and we thought they were perfect, and look at now there were challenges, but nobody talked about them.
right.
But it's interesting to us because we were probably the ones at the time thinking, man, they're so perfect. I think in my middle age, what I realized there are no perfect families. Every families have struggles. So let's just be authentic and help each other through them.
Yeah, exactly. Yeah, there's no such thing as perfection. We need to stop striving for perfection, for one, right? Because, what is that? We're all doing our best. And for me, it's always, and I talk about this a lot, it's like, if you want to, improve and change, it's that one little piece, like find that one little thing that you can start doing. And you gave some very incredible tips today and recommendations. So I appreciate all of that. Okay, I have a couple other questions that I want to make sure I get asked of you before we have to go. Is there a difference between postpartum depression and pregnancy depression? They're essentially one and the same. Now, hearing you say, because it starts either, actually pre-pregnancy, right? So it's really all the same. Why is it exacerbated postpartum? I guess that's a better way of wording it.
It's actually not, Erica. That's the myth. So,
okay. Do tell.
Really great question. It's just that there's been a lot more attention on postpartum. We've known about it longer. There's more media where, women are afraid of postpartum depression, but there's really no difference in symptoms. And there's not really difference in symptoms with depression outside of pregnancy either. Are the rates higher in pregnancy postpartum than they are outside of these periods of time in a women's life? Yes, they seem to be. But depression looks the same. The symptoms look the same. The challenge is, of course, the context is different, isn't it? A new baby, the tiredness, fatigue that brings, feeling unwell for some women, pregnancy, the same. So it's just the context in which it's placed.
Okay, thank you for
Is that
clarifying.
helpful?
So yeah, absolutely. And you're right. There has been a lot more emphasis put on postpartum depression. And
Right. And the
could,
problem with that is, can I pop in here, Erica?
yeah, go
I
for it.
think the challenge with this is then women are looking earlier.
Mhm.
So they're minimizing feelings of sadness, worthlessness, low self-esteem, depression, anxiety, worry. They're minimizing it in pregnancy because they don't know it exists. They just simply feel less than because they don't feel joyful. And because they don't know about it, they're not checking in with their physicians, etc. So it doesn't get treated. Yeah.
Okay, so speaking of physicians, so I was reading that and where you were talking about what was the percentage of like women that don't tell their OBs that they're experiencing anything, number one, because their OB doesn't ask. But you
Right.
said something about, what is it, 95% of women said that if their OB asked them how they were feeling, are they having any of these, kind of a screening in a sense, that
Yeah.
then the OB could step in and help give them a resource.
Exactly. That's the problem. Physicians don't ask, women don't tell.
Mhm. Yeah.
So we're in this very bad cycle. So the way around that, until all physicians start asking and we start getting screening as part of routine prenatal care, the way around that is for a woman to know she's simply going to have the courage to say something in that visit, to say, I'm not sure this is right. I'm not sure whether I'm struggling with this or not. One of the things that keeps women back from that is if their partner or their friend, very well meaning, has said, no, everybody feels like that when they're pregnant. Everybody struggles with their mood swings and emotional swings. But if a woman in her gut, let's go back to that intuition piece again,
Mm.
feels like, I just don't feel like this is right, check it out. Never be afraid to check it out. And may I say, as a clinician, that if your physician discredits that or says it's impossible for women to feel this way in pregnancy, or doesn't want to move with you to get further assessment, I think maybe it's time to think about another physician, because this will go forward and you just won't be satisfied going forward. I know that's a simple answer, but let's call it what it is. There
Yeah.
are some physicians that simply don't want to deal with mental health in pregnancy.
Yeah. Thank you for saying that. And I preach that too with just health in general. You need
Yeah,
to find someone who's in your corner
yeah,
and has the same priorities for you as you do for yourself. And if you're not in the same
exactly.
wavelength, then it's not a good team.
That's when we've kind of started coining the phrase owning your emotional health.
Mhm.
Own your emotional health. Take responsibility. Don't put your physician in charge of your emotional
Yeah.
health. That's never going to be a good solution.
Yeah. We have to recognize things on our own, which is hard to do sometimes.
It is.
But that's also where, I think asking your partner or those around you, maybe
Mhm.
they can reflect upon you if they've noticed a change or a shift in, sometimes maybe you think it's just a phase or whatever. I don't know. That's just a thought that comes to mind for me. So I know you have a way for women to screen, and it
Yeah.
works for any phase of life, right? Not just for pregnancy, right? It's like any time of life. Correct?
Yeah. Yeah. There is on our website, there's a couple, Erica, and you can hook into those if that's useful to you.
Absolutely. Yes, we will. We'll
It's
put it all in the
10
show notes.
questions, right? 10 questions. They take hardly any time to answer. There's some tools on there too about anxiety, stress, and depression, and assessing how you're doing. What we're hoping to do as well, Erica, we're just at the midst of presenting a book called Pregnancy Brain to publishers. So it'll be published through a New York agent, but that will also have tools attached to it and an online screening tool as well. So and those can be very useful for helping people to understand. I remember one woman in particular, she said, I've always struggled with this, but I didn't realize it wasn't normal until I had to answer these questions. I realized that screen, just in doing those questions, that, oh, this really isn't normal.
And I think the biggest takeaway message is that there are things that you can do, right? So that's my next question I want to kind of wrap up with a little bit too is, so we gave a lot of suggestions. So for anyone listening, if you go and answer those questions and you're like, or you just know, yes, this is something I've dealt with, some of the things that Dr. Kingston mentioned in the beginning, obviously is a great starting place because they cost you nothing and you can start them right now, which I always love because you don't have to think about it. You don't have to wait. Just do it right now in the moment. But do you address anything dealing with, supplementation as far as, right? Obviously the brain is involved. And, I know with pregnancy and each pregnancy after that, women's brains in particular can become depleted. Is that, and let me ask you that to verify that. Is that true? I feel like it makes sense, right? Baby takes a lot out of mom. Mom may not be, you're sleep deprived, and that's really hard to catch up on that, and that affects you. But from like a nourishment perspective, like, are you big on saying, take more fish oils, take some, phosphatidylcholine, obviously getting rest when you can? Do you have anything to add or recommend to all that?
Erica, I think that the evidence is so unclear on the supplementation piece in terms of prevention or treating depression, anxiety, and stress. So at this stage, I think it's not we're not recommending it as part of routine care just because the evidence just isn't really clear on it at this stage. Do I think there's probably something nutritionally? Yes, I do. Talk about things like keto diets and low carb and high fat diets and whatnot, and the impact that has on health. Yes, I do. So it doesn't mean that it's not great or that women might not find benefit. It's just that the evidence isn't clear yet. That's all. Yeah. There's been lots of things that are fantastic. It took a long time to build mindfulness and meditation evidence for depression. Doesn't mean it was ever not great. It just meant we couldn't say it was great. So right. The evidence just isn't quite there yet, Erica.
Okay. Well, hopefully we'll be getting more and more. Yeah. And when you find out more, we can have a next piece to like dive deeper. But one of my biggest things I feel like that you spoke about today that I haven't heard anyone address that can really be an underlying piece of anxiety and depression is stress. Yeah. So I feel like if you do nothing else today, but start to recognize what are your stressors and then what is something you can do, that could play a huge role.
Yeah.
Okay. Yeah. Thank you. Thank you so much. Do you have anything else you want to add to anything?
I wonder if I could just add one piece that sometimes keeps women back from getting help, which is, important to know, important for us to know. Women don't get help for certain reasons. But one of the reasons women hold back is because they're worried that their physician's going to put them on an antidepressant. Oh. So can I just hit that for one second?
Yes, please. I was going to ask, and then I wasn't sure if we wanted to go into that direction.
We can talk about it again more if that's interesting, Erica, down the road. But two things. You don't have to go on an antidepressant. Sometimes they're useful if you're really, really having severe symptoms. And it's the first starting point to be able to move on and deal with how you're feeling. But not every woman has to do that. And really, the number of women that have really severe depression is 7, 8, 9%. It's the smallest number. So most women have mild or moderate that can be treated by these things we've talked about, self-management, or by a talking therapy, you know? So you don't, going to a physician for help doesn't mean that you have to go on an antidepressant. You can again own your emotional health, say no thank you. I would rather be referred to a therapist as a starting point. Or no thank you, I would rather try some self-management strategies, knowing that you can always go back if it becomes worse. But most women that start that have mild or moderate depression or anxiety, it stays mild or moderate, and until it gets dissipated. Same with depression. So most women that have severe depression right up front are probably going to need some kind of help to just get them to the point where they can start self-managing or can start doing a talking therapy. But those are the women that, for the most part, are not getting out of bed in the morning. It's tough to get out of bed, really struggling to carry on in life. So my big message is, don't let that hold you back from getting help. You own your health. You own your emotional health. You can make decisions about what kind of care that you do, but don't let that hold you back from starting the process.
I love that. Thank you for sharing that. And I think, a piece of that is it's always like it's a for now thing, not a forever thing too. So if someone listening, because
Right.
everyone listening is very, holistic and wants to do things as natural as possible, but sometimes you need a little medical intervention for right now. And then it can help you, but not forever. So it can just be a short period of time. Do you
Right.
have on your website a list of incredible therapists that you recommend for anyone that's looking for someone, or how do we get anyone listening to know that they're going in the right direction of finding a right therapist if that's what they're looking for?
Yeah, I don't have it on my website, Erica. What I would do though is look up either by state or by province. Most places have an association for psychologists. That's the place to look that usually has a list of psychologists that practice. So that would be the first place. I would also say, if you go to a psychologist and it's not a good fit right off the bat, move on.
Yes.
Find somebody that's a good fit. It's all about what meets your needs. Don't waste your 6 subsidized visits or your hard-earned cash on somebody that isn't a good fit. It's really important to have that fit.
Well, thank you, Dr. Kingston. And will you just share one last time with everybody where they can find any additional information? I highly recommend, if you're listening and you're like, I need to learn more, you have to go to her website.
Well, thank you, Erica. And we have places to ask questions, and we're completely
Okay.
open. We love getting questions from women because it helps us to know where women's hearts are at as well and how we can help. So thank you for that, Erica. It's been so much fun, Erica. Thank you.
Yes, thank you, Dr. Kingston. And we'll put any links that you have mentioned in the show notes, so everyone will be able to find everything very easily. So thank you so
Oh,
much.
thank you, Erica. Bye for now.